pamphlet. We distributed 250,000, and we did the whole campaign. And alhamdulillah, I'm very glad to tell you, every single day we're graduating more than 100 to 120 individuals. We've so far covered more than 1,500 over the last month. Our target to reach more than 20,000 only this year. And this is the campaign. Another campaign, which is basically another story, touchy story. What I'm trying to say here is IMC is not a hospital. Every time we have a case in which we have to defend patients' rights, we do not confine ourselves to the four walls. We go wherever man, woman go. We defend them. So that's another case in which there was a negligence, and we felt we have to take this case as a public awareness, and we've done that as well. That's another case, and how a person could be have a very clear mission of life. We go out to students. That's one of the multiple meetings we have with the youth, and they're from high schools, and this is in the Chamber of Commerce, and that was attended by more than 1,000 students. And we try again to help those students and youth find a way by providing them an example of life. Many conferences, from diabetes to heart to osteoporosis, workshops. Now, the second crescent, which is the body, no compromise in the quality of healthcare. From the perspective that any compromise is a betrayal of the trust. If we as healthcare providers are aware of one criteria that will add safety to a patient, and we do not pursue it, then we have betrayed the trust of heaven. From the design of the facility, which took 4 years designing on papers, by the way, 1 million square foot, which is almost 100,000 square meter, which should take us about 5 years to build. Alhamdulillah, it took us only 2 years to build. However, the planning, we took our time. We applied the healing by design concept because there are certain elements in the design that helps patients heal, like natural lighting, greenery, landscape, color scheme, fire protection, even earthquake protection. When we started designing the facility in 1997, they told us, why would you like to throw a couple of million riyal to make the whole building earthquake protected when it's not an obligation? And it wasn't an obligation at that time. And the answer was as simple as that. Yes, true, we might not have an earthquake for the next 40 years, but God forbids, if you have one earthquake after 40 years, and one life is saved, even if I am in my grave, that could be my ticket to heaven. وَلَا يَدْرِي أَحَدُكُمْ أَيُّ الْأَعْمَالِ تُدْخِلُهُ الْجَنَّةِ. And even if there's no earthquake, we believe that God still will reward us for that intention and what we have done there. So the concept at IMC, we should always answer to a higher authority. The third crescent is the soul. How do we create a culture, an environment in which the healthcare providers are keen and attentive to fulfill the psychological, emotional, and spiritual needs of their patients? And that's a paradigm shift. Paradigm shift to what I have studied in the 1987 at George Washington. At that time, it was a taboo to talk to a patient about anything but his or her physical illness. And if we did, as a medical students, we could be kicked out of medical school. By late 90s, at Harvard, I did a fellowship with a man called Dr. Benson, who is the founder of the Mind-Body Institute, in which we learned how we can help patients heal from within. What are the practices which helps patients heal? And we learned how to pray with patients, okay, regardless of their religion. Because the way we view it, religion is a form, but spirituality is a need. And we as a healthcare providers should be able to fulfill the psychological, emotional, and spiritual needs of the patients regardless of their religion. This is a conference in Boston in 1997, attended by 1,000 healthcare providers. Even the choice of the verses was selected very carefully, and we always find out who will be standing there and what kind of a message that person needs to receive, whether a patient or a doctor or a visitor. Internal court, we insisted to have internal court. The architect said, no way. Now the architect in Boston says, I will never design another hospital except for one with internal court. And the leading architect, Dr. Sami Angawi, was behind forcing that concept and making sure that the healing by design concept is applied. And that's what makes IMC today is different and unique. One bed per room. In 1997, we insisted to have one bed per room. The architect told me that they've been designing for more than 100 years. And you're not going to come and teach us now. You have to have a word. You have to have more than one bed per room. And we thought about it. And then I said to him, no, it doesn't work. He said, why? I said, well, I learned something from my prophet. And every time I apply it, I seem to do the right thing. And he said, what is it? So I said the verse of what Prophet Muhammad said, وَاللَّهِ لَا يُؤْمِنُ أَحَدُكُمْ حَتَّى يُحِبَّ لِأَخِيهِ مَا يُحِبُّ لِنَفْسِهِ. I swear, none of you will become a believer until you love for your fellow human being what you love for yourself. I said, I always close my eyes, and I imagine myself in that situation, and I write exactly what I would have loved for myself. I open my eyes, write it down, and say, this is exactly what I should be giving for that person. And I seem always to do the right thing. And the wise thing. He said, you're making a big mistake, and you're going to regret that decision. I said, how could you put two people in one room? How could you? One of them develops an infection. By the time you discover it, you put the other one at risk. One of them can't sleep overnight. Nausea, vomiting, diarrhea. Why the other one has to suffer? One of them deteriorating, the other one improving. Each one will affect the other one negatively. Where is the privacy? Where is the hospitality? The word hospitality is driven from the word hospital, applied to 5-star hotels, and then hospitals became devoid of hospitality. I told him, we're going to bring hospitality back to where it was originated. He said, you're going to regret that decision. 2007, 10 years later, we opened the facility. The new law in America, no license for a hospital except for one bed per room, based on the infection rates and based on the cost of having more than one patient per room due to the infection rates. Now, so we're 10 years ahead of the game. Is it because we're smarter? No. Simply because we care. And I don't care how much you know until I know how much you care. And that's the key of IMC. If you start caring, you find out that you can do things better than others. So now we're very proud today to say that every single room has one bed. Now, this is some of the gardens at the International Medical Center. We have 4 gardens. Global standards. In 2000, we signed with the Joint Commission International. At that time, I still remember the first investor, who happens to be my father. He picked up the phone and called me, son, here other hospitals say you are wasting your money. And you're bringing something called joint something, and you're throwing your money to get standards. Why you do that, son? And I explained to him that as a conscientious healthcare provider, if there's one criteria that will add safety to a patient, then I'm obligated to pursue it. Otherwise, I shouldn't do anything. So anyway, he gave up. So we signed with them. We paid heavy money at that time. We're one of the few people who started the Joint Commission at that time. Now, all those hospitals who criticized us, later, 2 years later, in Saudi Arabia, the quality became hot topic. They introduced something called MRQP, Mecca Region Quality Program. And guess which standards they took? They took the Joint Commission standards. So all those who criticized us start going and running to get the Joint Commission International. But these two are not the same. And God knows who signed because they want to improve quality, and those who did it because they have no choice. And the rewards came. We passed our joint commission with the help and support and of the early farmers of this place, who carried the whole thing to their heart, with their heart. Not only that, we have passed with a score of a 98.2%, the highest score in a tertiary care center in the history of Joint Commission in the Middle East. Therefore, I was selected from the Joint Commission to be on the subcommittee to evaluate the new standards, which we just approved, the 4th standards of the Joint Commission International. And this is some of the comments of the Joint Commission when they came. The interesting thing they say, yeah, we've seen other hospitals with high standards, but there's something unique about this place. People are happy. There's something more than just what we saw anywhere else. There is spirit to this place, and it's true. This place has a spirit. Even the commissioning of this hospital, we could have brought a company from the States or Europe. The early farmers of this place commissioned this hospital. There's an agony, there's struggle. Every wall here has a heart. It breathes with the agony and struggle of the people of that place. That's a picture of the 13 members of the Joint Commission, and I do represent the Middle East in that committee. Partnership affiliations, even though we're only 4 years old, with God's help and support, we have many partnerships. Started with the Cleveland Clinic, and the interesting thing is we signed with the Cleveland Clinic Foundation the time of September 11, a time where difficult for any institution in the States to sign with anybody in Saudi Arabia, and that was the first partnership of its kind in Saudi Arabia, and that's why we received the award of the best investment in healthcare. And remember Dr. Loop, who was the one who not only accepted the partnership, but really cherished that partnership from day number one. He refused over 15 years to go partners with many, many other countries. But he saw the mission and vision and thought this place is different than other places I've seen before. Divine ethics, many examples. One example is the water treatment. I don't know if some of you know or not. We are the first institution in Saudi Arabia, and we have documentation of that, the first one, which has a comprehensive, complete water treatment plant. No sewage comes out of IMC. Comes only clear water. We save 30% of the water consumption. And as you know, water is more expensive in Saudi Arabia than oil. And we've been taught by our leader and prophet that if you do an ablution from a running river, don't waste water. لا يسرف أحدكم إذا توضأ أحدكم من نهر جاري فلا يسرف. So we want to apply those concepts. So 30% water consumption was saved. We introduced a new concept of saving the natural resources. And what we have done, we found a garden deserted next to us. We developed the garden. We connected to it the water that has been treated at IMC. We saved up to $500,000 riyal a year of irrigation from a cost. And we brought to the municipality a new concept of developing gardens. And that is with no financial gains, only partnership between the institution and the city of Jeddah. I truly believe that the power of any individual and the power of any institution is not in what you see, but it is in what you do not see. Exactly like the fruits and the roots. The roots is what makes the tree, not the fruits. Sometimes the fruits lags behind. You could have a decaying root while you still have some fruits in the tree. And as an engineer, I always wondered this, I call it moving city, because I've drove by one of those in New Jersey. They're phenomenal. I always wondered as an engineer what it takes for this thing to turn right and left. And I thought it should be something big. But to my surprise, it was something simple called a trim tab.